Hi there everybody, it's Dr. Joffrey here from Chicago Hair Clinic, and today I wanted to talk a little bit about hair restoration and hair transplant, same thing, procedures. Now, just as a reminder, we have to use the concept of what we've talked about in previous videos, which is that there's a hormone called DHT that in some people makes the hair back here in the crown area and in the front fall out. So that's why most people with baldness, most men, have a horseshoe pattern of baldness. The areas on the side of the head and in the back here are not sensitive to DHT. And so those are the areas that actually will stay there even when the DHT is in the blood. So the concept behind hair restoration or hair transplant surgery is that you're going to take hair from areas that are not sensitive to DHT and place them in those areas that are sensitive where the hair has been lost. Now, an important thing to remember is hair takes on the quality of where it was removed. So if this hair back here is not sensitive to DHT, when you move those follicles up here, it's not sensitive there either. What that means for you is permanent hair in there. You don't have to worry about it falling out again because of the DHT issue. So the main two procedures, or well, the main procedure I should say that's done these days in most offices is still what's called a strip procedure. It's called a strip because you take a strip of scalp, you remove it surgically, and then you basically take out these follicles and then you put them up in the area where you need the hair, the balding area. Now, there's nothing wrong with that. It's a great procedure. It's been done for many years now with great success. But I want to tell you about another thing that we're doing here at Chicago Hair Clinic, which I think is a game changer, and I think it's a much more elegant procedure, and that's called automated follicular unit transfer. Right now it's going in the US by the trade name neograft, and it's really my favorite technique for those people who are actually good candidates for it. So in this procedure, literally what you're doing is you're taking the neograft machine, and what it does is you literally take, instead of taking that big strip of scalp out surgically, you're taking one hair follicle at a time, and you're placing it with a little suction pin thing that basically sucks up that hair follicle, and then you place that hair follicle in the same area. Now, so you're skipping the whole surgical part. You're not taking out a big wedge of scalp anymore. You're making small pokes, one follicle at a time, and there's multiple advantages to this procedure. Now, one is obvious, right? You have, in the strip procedure, you're going to get that smiley scar type of remnants from the procedure, which makes it difficult a lot of times to wear your hair really short. Now, with neograft, you got these little pinpoint areas that will allow you to wear your hair as short as you want. Essentially, there's no smile scar there. Now, if you ever wonder why everybody shows their hair pictures from the front and you never see it from the back, well, that's the reason. Because with a strip procedure, the back of your head is not going to look that great in most cases unless you keep your hair really long. The other thing is because of the little suction action of the neograft, the follicles really don't get damaged. So, in a strip procedure, in the best of hands, you're going to have maybe 80 to 85% of take of the hair that's transplanted. That means 15% of the hair that you get transplanted, forget about it, it's lost. But with our procedure, with this neograft procedure, what we're finding is maybe 1 to 2% of it actually goes away. The rest of it stays. So it's a beautiful procedure. It's very elegant. Doesn't leave a big heinous smiley scar that prevents you from wearing your hair short. So you should check it out for sure. Give us a call at 847-995-9000 or go to chicagohairclinic.com and check it out. Contact us through there. Thanks for listening.